Thank you, Jennifer. February is Dental Health Month, and a free screening today could help you and your family. Dr. Hamamcy is with us from Texas Smiles of Austin with some tips on keeping our teeth in tip-top shape. It's good to see you. Thanks so much for being with us. We want to talk specifically about your kids' dental health because it is so important, and maybe some parents think, well, their baby teeth are going to fall out anyway, right? But there can be some major problems, as we were just talking about.
Well, children do need their teeth for their self-esteem, speaking, eating, and you know, when they're up there in front of their friends giving speeches and stuff, it's going to really affect them. It'll affect their self-esteem as well as their speech.
So what do you recommend in terms of dental health for the little ones? I mean, you can brush as early as they get the teeth, right?
Absolutely. You should definitely start brushing as soon as they get teeth. Preferably start cleaning their mouth before they get teeth. So after you give them a bottle, whatever time it is, you might want to take a little soft cloth and gently wipe down their gums.
Okay.
And the reason you do that is it prepares them for receiving a toothbrush later on so that they're not so resistant to it.
Okay, here are some other tips for maybe some older kids. Stay away from soda, and that could be pretty much for everybody, right? I mean, that's the big culprit these days, right?
Soda's a very big culprit. So are a lot of sports drinks and energy drinks. They have acid in them and they have a lot of sugar, so they're really bad for your teeth.
Okay, drink milk during the day and then water at night. This is something we do in our house too. You know, they want milk later on, but there is some sugar in milk, and you say sometimes people, you know, send their kids to bed with a bottle of milk, and that can be really bad.
Absolutely. It's not the amount of milk, the amount of sugar that's in the milk. It's the fact that it sits on their teeth all night long while they're suckling on that bottle. So you do not want to send them to bed with a bottle filled with anything other than plain tap water.
Okay.
It's very important.
And encourage fruits and veggies every day. Brush and floss regularly. Now, I guess you want to instill this like twice a day and floss twice a day too, or once a day?
Once a day is generally enough. If you feel the need to do it more, certainly go ahead and do it, especially if you have gaps between your teeth and food gets stuck. Go ahead and get that food out. Otherwise, it just sits there and it tends to cause a cavity.
Okay, and see the dentist twice a year. At what age do you recommend they start seeing a dentist?
At least at 6 months of age. So that usually they start getting teeth about 7 months of age, so we can kind of prepare the parent and help them learn how to brush their children's teeth and learn what foods to avoid and drinks to avoid.
Okay. Now, you also brought in some things that you use to help teach kids and maybe make them feel a little more comfortable when they come to the dentist's office, because even as adults, you know, we sometimes don't like going to the dentist, but we got to do it. But what do you have here? This is kind of cute.
Our office is very kid-friendly. We have lots of things around there, like this dinosaur here. The kids love playing with him, and we usually use this dinosaur to help ease their anxiety. We show them what we're going to do to the dinosaur first. We show them that we're going to count their teeth, and then we show them that we're going to clean their teeth, and we even show them how to brush their own teeth on this model so that when they go home they can do it. There's a little caveat there, though, that I need to explain. Parents should be helping their kids brush and floss. You want to think about how a child's handwriting isn't very good. Well, if their handwriting isn't very good, then they're probably not very good at brushing their teeth. So that's why they need the extra help with brushing.
Okay, and then this here, this is something you also show kids.
Yeah, we use this for the older kids generally. They seem to find that this is interesting, and it makes a good point, because what we do is we open it up and we show them how oftentimes people are always missing these very back teeth on the tongue side. And so we encourage them to get way back there, and parents too. Now, the free screening today, tell me about that. Well, we're located at 500 West William Cannon Drive in South Austin. Our phone number is 326-3473. Okay. We will be doing free dental screenings today for children ages 1 to 21. Okay. We accept Medicaid, CHIPS, cash. For those who are paying cash, we offer the same low rates that you would get with Medicaid, because I know that a lot of people are strapped right now with the economy and everything. And the screening, basically, what we're going to do is we're going to take a look inside and see if you need further examination. If there's obvious decay, we're going to tell you about that. If there's something that needs to be taken care of right away, we'll tell you about that. And we'll also give you toothbrush, toothpaste, floss, and talk to you a little bit about how to prevent decay.
All right, that's going on from 10 until noon today. Thanks so much for being with us. We appreciate it.